Hi, I'm Ruth Gay. I'm the Director of Public Policy and Advocacy for the Alzheimer's Association. And today is March 4th. We're going to be visiting our legislators on our Advocacy Day in Sacramento. And we have three main bills that we will be talking about today. The first one is a bill called Assembly Bill 1570. And this bill will require residential care facilities for the aged to have a minimum number of hours of training for their hands-on staff. This includes 12 hours of dementia-specific training for every facility in the state. This is an important change for us these days. There's very little training required of residential care hands-on staff, and this would not only raise the bottom line level of training overall, but the fact that it includes specifically 12 hours of dementia-specific training is important because we know that 50 to 60% of the folks in those assisted living and residential care facilities have some form of dementia. Another component of this legislation will require community care licensing to increase their inspections of these facilities. Currently in California, a facility in this state may get only one unannounced inspection in a 5-year time period. That means a facility could go almost 10 years with only one inspection during that period of time. This law would require that unannounced inspections be increased and that there be monitoring available to manage and supervise to ensure that the training is being received as required. The second bill that we're going to be looking at is Senate Bill 940. This is a bill about conservatorship in California. And when somebody has to be conserved in the state, what this law does is it equalizes the legislation across state lines. So if a family member is a conservator for their loved one, this right that they have will carry over as they cross over state lines in the United States. Right now, as it stands, there is no requirement that if you have a conservatorship for your family member, that will carry over if you had to cross over state lines for some reason. You had to move, or you moved the family member closer to you. Those may not hold up. Last, the bill is Assembly Bill 1552, and this is more of a standard bill. This is a bill that will allow continuation of adult day care programs, adult day health programs, who are now receiving services as part of the community-based services called CBAS, to enact that so that Medi-Cal can reimburse for that program. This is part of the new managed care initiative that's going forward in California, where Medicare and Medi-Cal eligible folks can be served in managed care. And CBAS will allow those people to be reimbursed if they are going to be attending adult day health programs in their community. For today, those are our three main asks. I think it's going to be really important that you visit your legislators and really work hard to get us to pass this legislation. So, I hope you can join us for Advocacy Day, but if you can't, there's always the opportunity to join us via social media. If you have a Facebook account, if you tweet, if you can do something to spread the word about passing this legislation, that would help us a lot. Many of the legislators have Facebook pages and they often tweet. If you send a message to your legislator asking them to please vote yes on these three bills, that will make a big difference. And you can be part of Advocacy Day whether you can actually attend in person or not. Thank you.